All right, now we're going to go over how to apply the triangular bandage as a sling and then swathe it with an ace wrap. So, triangular bandage, it's kind of what it looks like. It's that triangle-like shape. We're going to wrap it with the same ace band for the swathe. So before we begin, distal capillary refill on the fingers, right? Touch the finger, take the distal radial pulse, ask them to wiggle their fingers. They'll support their arm. Next, what they're going to do is we are going to apply the triangular bandage as the sling, either for the wrist, elbow, or shoulder injury. Again, if it's an elbow or wrist injury, we also have a SAM splint on there and it's ace wrapped on the individual. We're using the sling so it's supported by the neck so they don't have to hold up their arm. Or we're using this because of something like a subluxated or dislocated shoulder. We can use slings for major sprains or strains that aren't healing properly, but do not go and use a sling for something that's minor, because we want the muscle to actually move to learn. Remember the SAID principle, specific adaptation to impose demands principle. We want the muscle to move and learn, but if it's something that was more severe that actually just needs time and your activities of daily living are just poking at it, then we can sling it. Back to the triangular bandage. It kind of looks like this. It's just a piece of cloth that's a triangle. You can use pretty much anything. You don't need to buy. This is an actual triangular cloth for a sling. It could be anything. It's almost, just think if you're going out into the wilderness, you can just cut up a sheet or something in this size and create a sling material just like this. What we're going to do is we're going to take it and we're going to put the corner over here, the tip of the triangle, and this is going to be the long side of the triangle. And what we're going to do is we're going to create a sling by putting this part of the triangle underneath their hand and going behind their neck. The tip of the triangle is going to go towards the tip of the elbow. Make sure it goes actually underneath the arm so it's supported. So now look, we kind of already have that sling. What we're going to do is we're going to take the ends at the back of the neck and we are going to tie a knot. Again, I'm a little rough in general. She's not really hurt, so that's kind of, I'd be a lot more careful if someone was actually injured. But here I'm just kind of going with it to show you. You're going to need to adjust it depending on the cloth that you have. Tie a knot in the back of her head so that we figure out the angle that we need. The tighter you do it, the better angle we can get. Then from there, we're at least parallel. If we want, we can untie it and get it up a little bit higher above parallel. Above parallel. We do need to use the sling to do so. So once it's supported in there, that's basically the entirety of the sling. You're able to, if you want, use this corner part and tie a little knot so it has like a little ending. You don't need to, but it's kind of nice so they can reuse the sling and just keep putting it over their head if they're on their own. Then what we're going to do is we're going to apply the swathe the same way we did with the other splint. We're going to have the individual help us out here. Again, wrapping that swathe around the body to prevent that anterior posterior translation of that arm as they walk. Get nothing too crazy. Don't need to do this too tight. We're not trying to suffocate them by squeezing their thoracic cavity. Basically just applying it so that their arm can sit close to their body and they don't need to feel that movement. Again, at the very end, you're going to make sure you check PMSC, pulse, motor, sensory, and circulation. So at the very end, checking that cap refill, touching the finger, finding that distal pulse, and asking them to wiggle their fingers. In this case, I could have this sling go a lot more distally. If this was an elbow injury, we'd be fine. Even maybe a shoulder, we're fine. But a wrist, this wrist would also be supported with a SAM splint. So it would be a SAM splint with an ace wrap and then the sling. So it's okay. It's loose because this cloth is not as taut as the prefabricated sling. But it does exactly what it's supposed to do. So that is how you apply a triangular bandage sling with Swathe.